Okay, everyone, I think we'll get started. Good afternoon, and thank you for joining us. I'm Senator Fred Akshar, and it's an honor and a privilege to be here today representing this great community in the New York State Senate, and I want to welcome you all to this roundtable forum of the New York State Senate Task Force on Heroin and Opioid Addiction. I'd like to thank Superintendent David Gill. I'm not entirely sure if he's in attendance, but there you are. Superintendent, thank you very much for your leadership in this community and your steadfast friendship, quite frankly, when I was in law enforcement, and our friendship continues while I'm in the New York State Senate. I thank you for that. I promise you we'll do our best to be out of your hair by 6 p.m. As many of you know, this heroin epidemic is something that's near and dear to my heart. As a 15-year member of law enforcement, I spent a considerable amount of time working in the undercover narcotics world, and I have seen firsthand how this scourge has ruined loving families. And I self-admit that at one point in my career, I thought that enforcement was the key to solving the solution. But as I grew in my own career and educated myself, clearly we know that that's not important. I applaud the work that law enforcement does, quite frankly, on a daily basis. The men and women in uniform work extremely hard to deal with this issue, but it's clear to me that we need to do more by way of education, prevention, treatment, and most importantly, support for families. And even more importantly, I think, is ensuring that folks who need treatment have proper access to treatment. I have said often, and many of you have probably heard me say this, that this is a community issue that requires a community response. And parents, families, schools, law enforcement, treatment providers, and the government all have important roles to play. I think it's important to say this now that it's incumbent upon all of us sitting at this table and everybody who is involved in this community to set our political differences aside and our personalities aside. Because if we don't do that, we're going to stifle progress. And it's critically important to the people that we're trying to help that we don't allow that to happen. And that's quite frankly what brings us here today. We have an outstanding panel of local stakeholders here to discuss their roles in combating this epidemic. And I am pleased to be joined by two of our task force co-chairs, Senator Terrence Murphy, who's currently traveling. He'll join us as soon as he gets here. From Westchester County, and Senator Rob Ort from Western New York. Senator Ort, thank you very much. And our good friend and neighbor from the West, Senator Tom O'Mara. So today's forum, what we're trying to accomplish is three things: to explore what's working locally in our battle against heroin. Number two, to identify what gaps in service remain, and I think we all understand that there are gaps that need to be filled, and to discuss what we can do at the state level to help reduce barriers to care and strengthen our approach at the state level to addiction. Oral testimony is limited to those on the panel today. However, I recognize that there are a lot of people in the audience who've been touched by this epidemic and are equally qualified to speak on the subject. There simply isn't enough time, nor is there enough room on this stage. If you've prepared written remarks, please do your best to put them in the box out front on the table that says written remarks. Also, you'll find the written remarks section here. You can fill that out while you're here or take it home and mail it to my district office. Or, of course, you can visit our website, akshar.nysenate.gov, to provide your written testimony. The only thing I would ask is that if you're going to provide written testimony, you do so by April 20th, because the members of the task force need some time to digest that and put it all together. And then finally, if you'd like to receive legislative updates as to what the task force is doing on a daily and weekly basis, I ask that if you don't put any written testimony, you simply put your contact information, and we'll ensure that you stay up to date. Before we get started, I want to take a moment to recognize some special guests who are with us in the audience today. First and foremost, most importantly, are the courageous men and women on my Heroin Advisory Committee. I thank you folks for your willingness to come and see me on a regular basis, your willingness to share your stories and the trials and tribulations that you have been faced with in your lives, because quite frankly, it continues to allow me an opportunity to educate myself, and it affords me an opportunity to craft my personal legislative agenda. Assemblywoman Donna Lopardo, Assemblyman Clifford Crouch, City of Binghamton Mayor Rich David, County Executive Debbie Preston, members of the Broome and Tioga County legislatures, including Tioga County Chair Marty Sauerbrei. Marty, thank you for being with us today. Shenango Valley's YES leaders and their advisor, Matt Stanton, and leaders from the Tioga County Council on Alcoholism and Substance Abuse and the Broome Opioid Abuse Council. So I thank each of you for coming. Without further ado, I want to introduce my colleagues from the New York State Senate. Senator Orr, I'll start with you. You want to make some brief opening remarks?
Yeah, I'll be very brief because we want to get to our panelists at our roundtable here. But this is my 7th hearing or roundtable discussion that I've attended since being a member of the task force around the state. I've had one in my district in Niagara County. I've been to Long Island just last week. I've been to Penn Yan. I've been to Rochester, Albany. And while there are differences in each of those areas, sometimes significant, there are a lot of similarities and themes that you hear. In fact, it almost gets to the point for me that I couldn't tell you where I was because you start to hear the same issues over and over and over again as it relates to this epidemic. You hear the heartbreaking stories from moms and dads. You hear the challenges that law enforcement are facing every day trying to keep up with this epidemic. And you hear a lot of times from the providers who are on the front lines of this, trying to get people. They can't get people in fast enough. There's a waiting list. And there's a lot of challenges. So as my colleague Senator Akshar said, who I want to thank, by the way, for doing this and putting this together, even though I've been around the state, we've done 6 or 7 or 8, they haven't happened in every district. And the fact of the matter is there are certain senators who have really made the push and really focused on this and brought people in their community together to hear from them. And as he said, this helps us better represent you and helps us craft real reform and real legislation that makes a difference. And so I want to thank him for doing this. I want to thank my colleagues on the task force, Senator O'Mara, for being here as well. And, there's not one thing that we can do. I wish there was one thing that we could do tomorrow that would make it all better. And I realize, depending on who you talk to, if you talk to law enforcement, there might be 1 or 2 things that they think you should do immediately. If you talk to providers, there might be 1 or 2 things that they think you should do. You talk to a family, the bottom line is it's going to take several reforms, both resources, and I'm proud to say we just secured an additional new $25 million in the recently enacted budget, specifically focused to combating heroin and opioid abuse, specifically. That is a part of $166 million overall funding in the budget that goes to combating substance abuse, heroin, opioids, alcohol, and the like. So were it not for these hearings, were it not for many of you in the audience, and were it not for my colleagues up here, that $25 million would not be in the budget this year. So we're clearly making strides, we're making progress. It's a start, but there are things that we need to do beyond resources. We need to make sure that access to treatment is a real priority, almost treatment on demand. If somebody comes and says, I need treatment, I'm a heroin addict, I need treatment, you can't say come back in a month because you're probably never going to see that person again. And I also think we need to, on the law enforcement side, really zero in on the dealers who are using fentanyl and cutting up the heroin with fentanyl. Fentanyl, for those that don't know, is extremely lethal, and I'm sure we're going to hear about that up here today. That is one of the biggest reasons you're seeing the amount of deaths you're seeing as it relates to this epidemic. Because of the fentanyl, it's 40 times more lethal than heroin. And there are dealers who are knowingly, in fact, there was a dealer in Buffalo, not too far where I represent, he actually had fentanyl and he was cutting it up with heroin. In my opinion, that's akin to murder, the same as if he went up and shot somebody, because he darn well knows that when he sells that bag of fentanyl to somebody, it's highly likely you'll never see that person again. So there's a lot of things we can do, and there's going to be some differences certainly as we go forward on the proper course, but I think if we come up with a comprehensive package of reforms, and I know we're going to do that this session, along with the resources we have in the budget, we're going to save lives, and we can really put a stop to this epidemic. So I want to thank all of you who are here today for the courage, for taking ownership of it as a community, and I want to thank the folks who are up here as well.
Thank you very much, Senator. Senator O'Mara.
Thank you, Fred, and thank you for having this forum here today. As Fred said, I represent the district to the immediate west of Tioga County. I include Chemung, Tompkins, Yates, Schuyler, and Steuben counties in my district, so it's wide-ranging. It's suburban, it's small cities, it's rural, and this issue of heroin abuse and addiction is affecting everybody. It's not just an urban problem, it's not a suburban problem, it's not a rural problem, it's not a rich or a poor problem. It's affecting all socioeconomic classes like nothing I've ever seen before. And the additional funds in this year's budget, bringing our total spending up to $166 million towards addiction programming, is very important. But as the senators have said, money is not the whole answer. And it's going to take the whole community's involvement to work on this issue at all levels, not just with money, but with community involvement to tackle this from where we need to be, improving our methods on prevention, improving our treatment access for detoxification and inpatient treatment beds that are woefully lacking across the state, that we need to make improvements on. And I really look forward to the input that we get from those on the panel here today, and thank you all for participating. Thank you all for coming and taking time out of your day to be here and get involved in this important issue. You know, I am a former district attorney where I worked as an assistant DA in Manhattan and as district attorney in Chemung County, and I firmly believe that this is not an issue that we are going to arrest, prosecute, and jail our way out of, no matter how strong and how good our law enforcement is on these issues. It's just it's an addiction problem. It's a health problem that we're going to need to deal with more than just the crime basis, by increasing improvement to access. You know, I have 3 teenage children, and this issue really scares the hell out of me. In looking at my 3 kids that certainly I think are good kids, but I've seen so many stories in these task forces that we have had around the state of mothers and fathers talking, sisters and brothers talking about individuals that have gotten wrapped up in this addiction so easily, and many times as a result of opioid painkillers given as a result of surgery or other health problems that lead to this addiction and causes people to then turn to heroin because, frankly, it's cheaper and easier to get. So, you know, we have to look at the criminal problems, as I said, as a former district attorney, and firmly believe in increasing our ability to go after the dealers that peddle this scourge to our citizens, to increase penalties for that, particularly those where it involves a death, as Senator Ort said, and going after that. And we've been pushing for legislation to do that and have passed that in the Senate last year and this year. And we will continue to work on trying to get that through the other house of the legislature and before the governor. But really, it's a problem of prevention and treatment that we're all looking forward to your input here today. And thank you for having me here today, Fred.
Senator O'Mara, thank you very much. What I'd like to do in terms of making sure everybody in the audience knows who everybody on the panel is, Dr. Ryan, if I could start with you, just simply introduce yourself and title and who you're with, and we'll work our way around the table and we'll start our discussion.
Okay. Great. Yeah, I'm Chris Ryan. I'm the medical director at the Broome County Health Department.
I'm Ruth Roberts. I'm the Director of Community Services in Shenango County, responsible for the planning and oversight of the 3 disabilities: mental health, developmental disabilities, and substance abuse.
My name is Joe McBride. I'm the Shenango County District Attorney.
I'm Steve Cornwell, Broome County District Attorney.
William Palella, presiding judge of the drug treatment court program for Broome County, as well as the Veterans Treatment Court program for Broome County.
Carmela Pirich, Executive Director of the Addiction Center of Broome County.
John Berry, the Executive Director of the Southern Tier AIDS Program. We operate syringe exchange programs, so I'm the voice of harm reduction on the committee.
Jill Alford Hammett with Lord's Student Assistance Program. I'm the program manager.
Alan Wilmarth. I'm the Administrative Director of Behavioral Health for United Health Services System. Art Johnson, Broome County Mental Health and Social Services Commissioner. I've worked in the chemical dependency treatment field for 37 years.
I am Lisa Bailey. I am the parent of a child with an addiction problem. I'm also the founder of Valley Addiction and Drug Education.
I'm Michael Barton, founder and president of Dreams Over Drugs Foundation.
I'm Luann Nattershak. I'm a pastor with Inside Out Ministries doing jail ministry.
I'm Penny Stringfield. I am a parent who lost a child to a heroin overdose. I'm also the co-president of the Addiction Center of Broome County Board and a board member of Truth Farm.
Keith Nichols. I've been practicing family medicine in Owego for about 35 years.
My name is Barry Schechter, and I'm a clinical social worker, and I work with Dr. Nichols.
I'm George Dermody, the Chief Executive Officer of the Children's Home Wyoming Conference.
Pat Gary, I'm a captain with the State Police and Troop C.
Joe Zukoski, I'm the police chief for the city of Binghamton, and along with the Sheriff's Department, we have a narcotics task force that consists of 15 investigators along with our street crimes unit and additional 7 officers which are trying to fight this battle on our side.
Good afternoon. My name is Kate Newcomb. I'm the captain with the Broome County Sheriff's Office.
Gary Howard, Sheriff, Tioga County.
I'm Ernie Cutting, Sheriff, Shenango County. Ray Serowick, I'm the Emergency Medical Services Coordinator for Broome County in the Office of Emergency Services.
Well, again, to everybody on the panel, I say thank you for your willingness to come here today and take time out of your busy schedules and partake in this roundtable discussion. With that said, Penny, if you'd be so kind to start the discussion, and to everybody on the panel, I want this to be as interactive of a conversation as possible, so I'll try to lead the conversation the best I can, but as issues arise, if you have something to say about a particular issue that we're discussing, please just chime in. And Penny, you hold a very special place in my heart, and I would love for you to discuss this, start this discussion.
Thank you. As you hold a very special part in my heart as well. My son died in February of 2015, and he had begun a group called I'm Dope Without Dope and was trying to work with and help people who were struggling with the same addiction that he was. When he died, I decided that the only thing that I could do at that point was to continue his voice. And I spoke at a forum at SUNY Broome, and the next time I spoke, it was at a BOAC meeting, and Senator Akshar asked me as a parent if there were 2 things that I could accomplish by what I was doing with my voice. I said it would be that I would end the stigma of addiction and that I would do everything in my power to make sure that we had the proper treatment in our area that we need. I think we've come a long way with the stigma. And I think one of the reasons for that is because the heroin face is very personal now. Almost everyone knows someone who's been affected by this. I feel privileged that I have a voice as a parent, and I have shared Johnny's story for many, many months to anyone who would listen. So if I could have a minute, I have just 3 very short stories of other parents who've lost their children. My son battled his opioid addiction for 10 years that started with a prescription for OxyContin for a football knee injury in high school. He graduated college and was a successful chef. He was charismatic and had an enormous heart. He entered sobriety in jail in 2013 and maintained it when he got out, living his life in preparation to care for his son he was trying to establish paternity of through family court. When the baby was 8 months old, the judge finally ordered DNA test. 2 days later, the baby died. My son lost his son, and 6 months later, my son lost his life to a heroin overdose. After a long struggle with opiate addiction, Katie lost her battle. Katie was a passionate, fearless, and unconditional lover of those less fortunate, always rooting for the underdog. Katie loved the city of Binghamton. She was intelligent, witty, and complex. She had a special way with words, and her favorite pastime was sharing her views and opinions on Facebook. Katie, you deserved more, and the world was a better place with you in it. You were one of a kind. I don't need to read the last story because it's Johnny's. Johnny was also compassionate, loving, kind. He sang in the church choir. He preached every Sunday on Youth Sunday. He loved his grandmother. He loved his sister. He loved his dad. He loved me. He played sports. And he struggled for 5 years with addiction, also after having his ACL replaced when he was a sophomore in high school and became addicted to pain pills. For many years, we worked tirelessly to get Johnny into rehab, and he would get into rehabs over and over and over again for 3 weeks, 2 weeks, 1 week, outpatient. There was never enough treatment, and there was never local treatment, comprehensive treatment for him. I truly believe that some of our people who are addicted probably are better if they can leave their community. They need to get away from everything. I don't think that about my son. He also struggled with depression and anxiety, and he needed his family and his friends and his church. And every time we sent him away, he became more anxious and more depressed. And what I'm asking right now over and over and over and over and over again is please help us to get the services that we need. When I talk to parents that spend days and weeks on the telephone, calling places, begging insurances, it's wrong. It's wrong. And the longer that we don't do something about this, the more of our children we're going to lose. Thank you.
Penny, thank you very much. Lisa, if you wouldn't mind, as a parent, speaking a little bit now.
Sure.
Thank you.
I tend to talk too much, so I had to write it down to keep me quiet a little bit. Over 2 years ago, my husband and I started up a community group called Valley ADE. Our group provides support, information, education, and referrals for families and addicts. We started it because we know every emotion that comes with being the parent of an addict. We know the loneliness, the fear, the guilt, the sadness, the heartbreaking and heart-wrenching emotions. We live it daily. You see, we have a son who battles addiction. We were the good parents, the present ones, the tight-knit family. We had the white picket fence. My son was very smart, top of his class, basketball star. Unfortunately, that basketball star status got him many concussions because he was quite aggressive. His last concussion was labeled as a traumatic brain injury. That's where the initial drug use started. His headaches were severe and the pain medications were prescribed. Everything went downhill from there and it spiraled out of control. Things got bad, we were scared. My husband and I would take turns sleeping out of fear. We lived in disgrace, embarrassment, and total guilt. We didn't talk. You didn't tell anybody your problems. At this point, it was his senior year, and it was 2 days after his high school graduation. 1 a.m. in the morning, we find my son non-responsive and blue. My husband grabbed him, held him, and begged him not to leave us. They found rat poison in his system. They believed that his drugs were laced with rat poison. He had total heart failure, kidney failure, lung failure, and was on life support. We were told to say our goodbyes to our only son. However, he survived the unthinkable. That's when I found out I had no clue what to do. I didn't have the answers. I was the mom. I was supposed to know what to do. He walked out of that hospital with a follow-up appointment for his heart, and that was all. No information on addiction, no information on rehab, no information on detox, absolutely nothing. We didn't know where to turn. Countless hours at the computer with tears streaming down our faces. 4 overdoses later, a family torn apart, a drained savings account, and countless stolen money and family heirlooms, here we are. He has attempted inpatient, outpatient, Vivitrol, Suboxone, but every time he comes home, the addiction is too strong for him. During a tough time of addiction for my son, I heard a very special speaker say to think about your family in a boat. It's the parent's responsibility to keep that boat calm. It's the addict that wants to rock the boat and turn it upside down. She said sometimes you have to protect your family, and to do that, you have to throw your addicted child out of the boat. I hated that boat story, and I hated it that night. It goes against my enabling personality. It goes against everything a mom is supposed to do. We got home that evening after we heard that story to find our son passed out with his drug paraphernalia beside him. I heard my husband screaming. I took a couple deep breaths and went upstairs. My son finally came around, and I told him very calmly and simply to get out. I was done, and I wanted my boat. I wanted my family back. He is now in rehab in Florida. He's been there a little over 2 months. Does he still try to rock my boat? Absolutely, but my boat's not going to tip anymore. I'm attempting to let go without ever giving up on my son, without ever giving up his hope. But daily we fight addiction and the stigma and the demons associated with it. You've heard that drugs do not discriminate. No child wants to grow up to be that drug addict. Every addict is somebody's child, somebody's brother, somebody's sister, somebody's loved one. I think one of the hardest things was giving up who my child was, giving up the hopes and dreams I had for him, giving up that sweet, innocent boy who loved his basketball. Our group over the past 2 years has helped nearly 25 people get into rehab, referred countless families to different counselors, and done a variety of community services. We hold support groups for families, but we need help. We are just volunteers helping each other in our community. We need to provide access to treatment and long-term effective treatment options. We need to provide information, resources, and education. Drug addiction is an illness, and I think we are missing out on treatment opportunities and options, especially for the families in our area. There is treatment for all other diseases. When you are discharged from the hospital, you're given appointments and follow-up care for all diseases except addiction. When you walk out of a hospital after you've had an overdose, you walk out. We are missing the boat here. I'm so very proud of our accomplishments. I am so very proud of the group we have here. I am so very proud to live in New York State where we have people that care about heroin addiction. But I still can't beat my son's addiction for him. I have learned ways to take care of myself and my family. I reach out for help. I talk a lot. I cry and I pray. Drugs, again, do not discriminate. Addiction happens in the white picket fence families, and drugs affect not only the addict, the mom, the dad, the grandparents, and the whole community. But as a community, we need to pull together because you can't just come to these forums and you can't just listen to people speak. You have to do something, and something is better than nothing. Thank you.
Thank you, Lisa. I want to hit just a couple of things that were brought up, and then I'm going to move to Jill and Michael, if I could, about community outreach. But Dr. Ryan, can you speak specifically about maybe some statistical data about prescribed prescription medication is specifically in our district here that I represent? And I know that we've probably had some type of conversation before about that. The numbers are quite startling, are they not?
I don't have any data readily available on, say, for example, the numbers of prescriptions in our county. I don't know if Art does or not, but that's just kind of recently begun to be monitored with the iStop program.
Art, can you weigh in on the statistics?
Yes, I can. This was actually the first thing on my list to talk about. If New York State doesn't further reduce the unnecessary narcotics prescribed by doctors, dentists, and other practitioners, we are never going to see this problem go down. Last year in Broome County alone, Medicaid paid for over 900,000 doses of narcotics prescribed by doctors, dentists, and other prescribers. If you add private insurance to this, there could have been 3 million doses, pills, shots, patches, everything together, prescribed in Broome County. If we could get a 10% reduction, that would be 300 doses of unnecessary narcotics out of people's medicine cabinets. Every time I bring this up, people in the room say, yes, I had a tooth extraction and the doctor gave me a month's supply of Percocet. I only used 1 day's worth. Or I had a minor orthopedic procedure and I really didn't want any medicine and the doctor gave me a month's supply of Vicodin. New York State could also strengthen iStop. This is a state regulation that requires doctors and other prescribers to look up a patient in a database to see if someone else is prescribing them narcotics. I think that this is the single most important intervention New York State has done to reduce the number of new addicts coming up. But we need to do more. Before the iStop program, you'd have addicts getting prescriptions for narcotics from 3, 4, 5, 6 different doctors. This policy, again, more than anything else, is preventing new people from becoming addicts. And emergency departments, I think, should be required to to work with this database. They're currently excluded, I believe. And I'm not sure that anyone from the state is reviewing this database, because I recently heard from an addiction treatment provider that when they look up their patients in the system, they can see that some of the people had 3, 4 narcotics and maybe a benzodiazepine like Valium or some other tranquilizer type medication prescribed to them.
Thank you. Jill, could we, just a little bit off topic, could we talk about stigma and reducing that, right, Penny? I mean, that was one of the biggest things that we try to accomplish, especially.
Can I just quickly say
Please.
something about that? I think that one of the things that we're seeing, and the second story I read was actually a local recent obituary. When Johnny died, we made a decision as a family not to say that he had died unexpectedly. We said that he had died from an overdose, and we asked that as a legacy to him, people reach out to those around them that were struggling with the same addiction. And I think that the more that we do that, the more that we talk to people, and the more that we're all honest, that is helping to lift the stigma, because it's not another person, it's usually someone that's very close to you and in your own life.
Very good point. And I think in terms of helping reduce that stigma, I think we have a concerted effort in terms of community outreach. Yes. And I think as a community, I think we've done a fairly good job at that. So Jill, I'll ask you to speak a little bit about what you're doing and some of the activities that you've been partaking in, some of the groups you're working with, and then Michael, maybe you specifically can talk about Dreams Over Drugs and what you've been able to accomplish since you've been working in this arena. So, Jill, would you talk a little bit about that?
Sure. Thank you. Over the past 14, 15 months, through the Broome Opioid Abuse Council and Lord's Student Assistance Program, we have provided about 15 or 16 heroin awareness events. A lot of them are made up of a panel, much smaller than this, but we've also done some different things, a roundtable format for school personnel out in Deposit. We have done roundtable formats for parents in some of the local school districts, and we're looking at doing a debate type project between panel members and students to try to pull students' interest into this subject. I think what we've done is we've gotten people talking. I just came from a meeting this afternoon with a gentleman from Endwell who was incredibly moved by the heroin awareness event that happened in Maine Endwell. And he's come up with an idea. I have met with a member of the Endwell Rotary on Monday who was also very moved and wanted to learn more about this topic. And that's what I'm hearing people say. They're talking about it. They're finding out about other people who are affected, and they want to know what they're talking about. I think as a community, we're working very, very hard to reduce the stigma, and by getting those conversations out there with accurate information, we can really, really make a dent in reducing the stigma, educating the community, and hopefully get parents talking to their kids. Additionally, the Community Education Committee of the Broome Opioid Abuse Council is putting out wallet cards that have fast facts for parents, as well as questions that they can ask providers to address the issue of over-prescribing of medications.